Welcome to another episode of Focus On with me, Zanele Morrison. My next guest is Merawi Aragaw, and he is responsible for surveillance as well as disease intelligence. A conversation we're going to have around the role of technology, the role of sciences, and the role of education enabling communities. Mr. Merawi, thank you so much for joining me for this conversation. This conference has really been critical to lift up the level of collaboration and integration of all parties. From your perspective, especially considering that you look at the surveillance and the readiness for pandemics, are we seeing progress being made, progression from where we were before the pandemic to our current readiness and awareness for current pandemics and future ones?
We initiate as Africa CDC, we initiate a mapped out high impact pathogens across the continent. We call it pathogen prioritization in public health emergency management, and trying to have a deliberate and intentional investment in those priority pathogens. And Africa CDC is driving that one. I think this means a lot in a way that we can drive research and development priorities for the continent, drive medical countermeasure, manufacturing, supply, stockpiling, and distribution. Moving forward, we also drive science out of it. You know, it's not always like we're looking for outside to spare us any leftover. Yeah.
The challenge that we have in the past was foreign aid, be it aid organizations, coming in and determining what is the problem in the continent, and then telling us what solutions to implement, even if they don't really do not provide what we actually need, solving for one in a broken system. Are we changing the narrative? Are we seeing and starting to dictate how the help is required, especially when it comes to partnership with local providers who know what needs to be done? Is that changing? Are we seeing the tone changing, even in international partnerships?
There is a lot of opportunity now. The whole global partners are really coming, listening to us. We are taking some space in global leadership as Africa CDC, representing in different fora. And we are not really shy now. We are really presenting ourselves and our needs to the global north, to the global, public health architecture, that we need this. This is what we want to do. This is how we want to drive, and so on. Yeah.
There is definitely a boldness across all our leadership. In one of the panels earlier on, it was about leadership and changing the lens to the world of what the continent actually looks like. But then comes the question of financing, right? Financing, and we have a growing economy, huge gaps between financial access to financial well-being, as well as just healthcare. Do you see the role of healthcare practitioners moving and, if I could say, stepping down so that indigenous people are serviced by indigenous people, so that that youth are able to participate in healthcare in all stratas, right up to sciences and technology where we need that? So are we able to just look across every single person's need in the continent?
When it comes to financing, yeah, we need the finance for sure. And it's really demanding now. We have all other competing priorities, including developmental activities, and yeah. So, but how can we really drive? Health is not a liability, to be honest. We can be an asset in a way that research development in the health sector that can be nurtured and developed, that is really a huge untapped opportunity for the continent. We are 1.3 billion population. The market is huge. If you establish a manufacturing plant, it starts somewhere from research and development, somewhere in academy or somewhere. It goes all through, and it shifts the whole dynamics of market, the whole dynamics of innovation and job creation all across. And we have a very vibrant youth population across the continent. It is up to us really to nurture that youth and guide them to own these processes and also to coach them, mentor them to come to this space where they can really be the owners, be the drivers of economy, be the drivers of innovation in science, be the drivers of all societal change and development and economic development.
We don't often tie in healthcare or the impact of some of these diseases to the economy. So unpack that some more for me. What is the price of not ensuring that we are staying on top of the healthcare, and not just from a pandemic perspective, but diabetes,
Exactly.
all of those are also impacting our ability to deliver on this developing continent that we are. But as the expert, unpack for me, what does that mean for us economically?
Perfect. The quality of life you live is really dependent on how good your health is in general. If you are sick for anything, and that quality of life needs to be really costed. You may be off work from production, for example, for 1 week, 2 weeks, 3 weeks, and so on. If it is even like some diseases like diabetes that last quite some time, it will cost us a lot.
We live with.
Yes, they cost us a lot. Exactly. And when you go out and see the road traffic accident and so on, and so all these are really costing us a lot. And when it comes to infectious disease and injuries, this account around 46% of production, 46% around that production loss. Of the 2.4 trillion loss, can you imagine how much you are going to lose from infectious disease and so on? So all this can be really production, economic development, change, and that's the Africa we aspire to be.
It helps in the healthcare space that we see such intense purpose and focus on the collaboration and the aggregation of everybody's efforts into the good of the continent. My next guest is Dr. Mosoka Fallah, and he's the program manager for Saving Lives and Livelihoods. Look forward to a conversation that's really looking at the nitty-gritties of how a program like this, in collaboration with all their partners, is delivered effectively. So all of this started, I'm sure, with COVID-19. Lots of lessons were learned about lives, right?
Yeah.
The loss of lives, not only the loss of lives, but people lost livelihoods. So now, how are you directing these efforts towards perhaps the next COVID-19? Do you have ambitions for the next pandemic, and how you see yourselves responding to it?
I think what we've done for ourselves, one of the SLL, is we've laid a framework and an infrastructure that we call the pandemic preparedness and response for the next future. So basically, one of the first things we've done is that we've created organically grown implementing partner on the continents. We've worked with them, so in the future, we don't have to parachute Westerners to come in the country. They are closer to the problem, they have the solution. So 90% of all of our partners are African-grown organizations that we are working with in empowering. So that partnership works in our favor. At least one of the things we have done, as I speak to you now, we have deployed teams in 41 member states. Initially, we will run Africa CDC, SLA, will come from headquarters and solve a problem without having a permanent presence. But at least we're happy to know that as of the last 2 weeks, have deployed teams on the ground to continuously engage ministries of health, implementing partner meeting stakeholders. So you see, all of these evolving strategies are going to help us in the future for the future pandemic.
There is a big challenge around resources, around the education and development of healthcare workers, and it's not just our problem, right? It spans across. It's a global issue. Do you see the program being mindful of building the skills required to support the healthcare sector?
Yes, for all we realize that's critical. We know that part of phase 2, the thought is to building what we call workforce entrepreneurship. That's one of the biggest investments. It's going to come spend across community health workers. But don't forget, we are also investing in epidemiologists. Some of the people that we have deployed in country are core skills that are needed. We also trying to strengthen the National Public Health Institutes. We're creating center of excellences so that people can come and get the training. Africa still need around 6,000 epidemiologists. By investing in the National Public Health Institutes and these centers of excellence, we're going to create system and institution to train the health workforce of the future.
We'll be hosting this the CDC conference here in Lusaka in Zambia. And I'm thinking to myself, to what degree do our governments understand the impact of saving livelihoods on the economic development ambitions that we have in every single one of the developing countries that make up this continent? You know, is there a close partnership and understanding that the business of growing the continent is actually also in healthcare?
In some of the countries we went to, with very low results, we've seen improving results, but it's a way to help people to see the lead. And why is it saving lives? Because many of them will ask me, okay, we see the saving lives, but we don't see the livelihood. I get the question all the time.
Yes.
And so the thought process was that we'll take some of the funding and put in livelihood, but they didn't understand that by saving lives and creating an enabling environment, we are promoting the livelihoods. Because so many times we say that, but also the workforce that we invest in is a way of circulating funding in the economy.
Yes, because it's people who save lives.
Right.
And people with jobs and skills and competencies who save lives.
Right.
So and the reason why we focus so much on this aspect of disease control is Africa uniquely positioned to solve its own diseases that are up and coming, that are continuous, be it diabetes or your regular sort of life debilitating diseases. Do we need to uniquely do it for ourselves instead of importing solutions that are not created with our people in mind or their genomes in mind?
You know, we had a meeting when at the end of our first audit. Rita said something that was very deep and said, you guys have shown that the African can do it.
Yeah.
Because she was saying that you guys, we did the audit Deloitte, and you Africans have done extremely well in managing this fund. She was like, you had less than 1% ineligible. You clearly have demonstrated to the world that Africans can do it. You know, that was like a clarion call for us. And I think from the get-go, I think the concept of the saving lives has been and emphasized the African trying to find a solution. And so even when we engage member state ministries of health, the way we did our model, we co-create the country's needs and say, okay, these are our interventions. What is it you want as a country? The country then tell us their priorities and how much they want. And we say, based on your population per capita, this is how much money we can allocate. Then we sit in the countries and we do macro planning together. We say to the country, ministries of health, key stakeholders, and the partner, we say, okay, let's create the activities that will suit you. So that's how that has been very critical. There has to be what, first from the lowest end, what the country wants, that will then feed into what the continent wants.
Yeah.
And so that has really, really helped us a lot. And I think at the end of this, we will come stronger and say that Africans are capable of finding solutions for themselves. And
that's it for this episode of Focus On. I had the honor of interviewing Dr. Mosoka Fallah, who's the program manager for Saving Lives, Saving Livelihoods, as part of the Africa CDC program, sponsored by the MasterCard Foundation. From me, that's it. I'll catch you next time.